Good morning everyone. I am Farid Kanani here. I am going to present clinical decision support system for malnutrition. I am a student of Master of Information Technology where I took Health Info 730. We have two fabulous people with us, a lecturer Koray Atlag and tutor Mike Mary. This is my contents, how I am going to present. Firstly, I will discuss about malnutrition and then clinical decision support system and how CDSS functioning. After that, mind map of my DSS and then nutrition care process. After that, I will conclude. What is malnutrition? Malnutrition is a condition that results from eating a diet in which nutrients are either not enough or are too much such that the diet causes health problems. It may involve calories, protein, carbohydrates, vitamins or minerals. Not enough nutrients are called undernutrition, while too much is called overnutrition. We will understand nutrition screening is the process of identifying patients, clients, or groups who may have a nutrition diagnosis and benefit from nutrition assessment and intervention by a registered dietitian. Now, some of the key considerations may be conducted in any practice setting as appropriate tools should be quick, easy to use, valid and reliable for the patient population or setting. Tools and parameters are established by RDs, but the screening process may be carried out by registered dietetic technician and other trained personnel. Nutrition screening and rescreening should occur within an appropriate time frame for the setting. What is CDSS? Clinical Decision Support System offer clinicians, staff, patients, and other individuals with knowledge and person-specific information intelligently filtered and presented at appropriate times to enhance health and healthcare. The most common use of CDS is for addressing clinical needs such as ensuring accurate diagnosis, screening in a timely manner for preventable disease, or averting adverse drug events. However, CDS can also potentially lower costs, improve efficiency, and reduce patient inconvenience. In fact, CDS can sometimes address all three of the areas simultaneously. For example, by alerting clinicians to potentially duplicative testing for more complex cognitive tasks such as diagnostic decision making, the aim of the CDS is to assist rather than to replace the clinician. Whereas for other tasks such as presentation of a predefined order set, the CDS may relieve the clinician of the burden of the reconstructing order for each encounter. The CDS may offer suggestions, but the clinician must filter the information, review the suggestions, and decide whether to act or what action to take. The example of the CDS that address a range of target areas such as precautionary care, diagnosis, follow-up management, cost, etc. Here I will give you the quick overview of the functionality of CDSs. The health informatics researchers have developed clinical decision support system to help for decision making. Secondly, decision making in the healthcare domain is an essential activity for clinicians. The expert knowledge plays a significant role in decision making. However, the expert may make a wrong decision. CDSS is a computer-based toolkit that provides a decision for different clinical goals such as diagnosis and treatments. Out-of-date, limited, or uncompleted knowledge in CDSS can have a negative influence on decision making. There are a growing number of CDSS functions that are built into EHR systems. Under meaningful use, providers must implement one clinical decision support rule including diagnostic test ordering as well as the ability to track compliance with that rule. Now I will explain mind map of my DSS. First we will see the causes of malnutrition. The first one is vitamin disease. In vitamin disease there are two main disorder of vitamin A, B, B12, C, D and K, and vitamin deficiency. One of the main causes effect of hunger. In effect of hunger, it would be a lack of food, nutritional deficiency due to insufficient food are one of the main. nutritional deficiency disorder, nutritional imbalance, nutritional stunning, and disorder of hyperalimentation are also the causes. Now we will see the symptoms. So it will be identified by its symptoms such as fatigue, taste change, weight loss, difficulty of chewing, pain or dryness in your mouth, etc. Disease such as acute disease, disorder of pregnancy, metabolic disease, multi-system disorder, and weightlessness. I have extended my domain model during prototype phase. Now we will understand the procedure. There are numerous tools available in the market. However, nutritional risk screening to be used for adults only. The procedure of that, the first four questions are used as initial screening. The main screening is only done if any of the questions in the initial screening are answered yes. If all the questions in the initial screening is answered no, the patient needs a weekly rescreening. If the total score greater than equal to 3, the patient has a nutritional risk and a nutrition plan needs to be carried out. If the total score is less than 3, the patient needs a weekly rescreening. In addition, users would be clinicians, hospital staff, patients, and other individuals. These are the input variables like body mass index, weight loss, smoking history, lifestyle, etc. And output variables would be nutritional risk level, which is one of the main, 0 to 4, diet plan, drug recommendation, etc. Now we will discuss about the treatment. It would be a self-care. In self-care treatment, we can get the high protein supplement such as vitamins and minerals. The second one is supportive care, rehydration, uh, nasogastric tube for those who are unable to take the food, and specialist care like nutritionists and primary care provider. Now, if we talk about the technical part, such as data mining tools, Azure Machine, SPSS, Weka, Tableau, and Hadoop, with the use of algorithm, and we can get some insight from the data. For that, we need programming languages such as scripting language, Python and R, VB.NET, C Sharp, Java, some database language, SQL, Oracle, and we can use also HTML and CSS as well. Here I have retrieved a nutrition care process. Some of the part I have already covered during the mind map. Here I discuss some challenges that designer of the future clinical decision support system may face. It includes better interactions with users to understand their work context and utilizing customizable computer agents in the client platform. In general, user-centric and collaborative features of CDSS system impose higher level of abstraction and more intelligent service-based computing at both the application and middleware layers. These are the references which I have used. Thank you to Koray Atlag, Mike Mary, and all of you for listening me.